Good afternoon. I'm Lisa Altman, the Director of Special Events and Corporate Philanthropy for the Advent Health Foundation, West Florida. On behalf of our entire foundation team, we are so happy to have you all tuned in to this live stream today. In just a few minutes, you're going to hear from our panel experts about COVID-19. But before then, I'd like to take a minute to thank our event sponsor, Advanced Telecom Systems, and introduce their Director of Business Operations, Courtney Ray, to say a few words.
Thank you, Lisa. It's a joy to sponsor today's COVID-19 LinkedIn Live panel with these wonderful Advent Health experts. We are grateful to have a health system like Advent Health in our communities with care teams that go above and beyond to provide whole person care. Quality and compassionate care is evident in the way Advent Health has navigated COVID-19 from day one. We are honored to support Advent Health's mission through the foundation and to be with you here today to learn more.
Thank you, Courtney. And again, thank you to Advanced Telecom Systems for sponsoring today's event. It is now my pleasure to introduce Rochelle Haynes, Advent Health West Florida Division Director of Corporate Communications, to kick off today's event.
Thank you all and welcome everybody. I want to begin by introducing our panel of experts from the Advent Health West Florida Division. Joining us today is Dr. Doug Ross, Chief Medical Officer at Advent Health Tampa, our largest hospital in the West Florida Division, providing some of our most complex care and specialty care. Dr. Michael Longley, our Chief Medical Officer at Advent Health North Pinellas. And also we have Dr. Robin McGinnis, who is the Senior Executive Officer of Patient Outcomes and the clinical leader at the West Florida Division corporate offices. We'll call Dr. McGinnis our ringleader, if you will, of all things COVID. She made many of the decisions throughout the year that all of our facilities followed to make sure that everyone was safe and we were providing high quality care. Let's start talking about where we're at now with COVID. We've seen in the media reports, it's had its ups and downs. Dr. Doug, being at our largest hospital, where is the status now of what we are seeing with COVID cases? Can we hear her? Stand by 1 second, Dr. Doug, you are muted.
That's helpful. How about that?
There you go. You're back online with us.
I appreciate that.
It's okay. You save lives. You don't do IT. I prefer the previous.
Let me try that again. But first of all, thanks for having me on the panel. I'm happy to report that we're seeing a slow decrease of cases of COVID across our system and specifically at our hospital. We did see it's not anything like the surge we saw over the last summer, and things are improving, but still we're seeing a shift in the population. So that is concerning to us.
That was going to be my next question for Dr. Ross or Dr. Longley. We were seeing a real epicenter of seniors, the elderly, men specifically when this first came out. What are we seeing now, Dr. Longley, at your facility as far as the age that this is impacting?
Well, we're definitely seeing some younger folks being affected by the virus. But the facts are that the risk for acquiring the virus and for getting really sick are really still the same. I mean, we're concerned with folks that are overweight or obese, folks with other comorbidities like hypertension, diabetes, and then folks at extremes of age, of course, or those folks that are immune compromised. But we're definitely seeing some younger folks more recently, but the avoidance and hyper awareness for the folks that have other illnesses that go along with their daily lives are really still our focus.
I would say that it's been both fascinating and probably frustrating from a public sense to watch what I think is science playing out live. For the first time in my lifetime, I'm seeing something be introduced, and all of the scientists around the world trying to attack this at once in a very quick fashion. Dr. McGinnis, can you talk a little bit about how we pivoted and stayed flexible and what that meant for our care teams while this is happening?
Absolutely. And you described it perfectly, because evidence, as much as we've learned about the virus, we've learned that we need to continue to learn more. So as soon as evidence came out that we need to execute a protocol or practice, our job was to be able to get that information out to our frontline team members for us to implement that. In the beginning, it really was to be sure that our team members were safe and our patients were safe. We needed to be sure that they had the right PPE, needed to manage the PPE appropriately, have the right masking protocols, et cetera. We needed to test and have access to testing. So we were able to identify which patients were having symptoms of COVID, became positive with COVID. We wanted to be sure that we can get those test results timely so we can execute the protocols and get them under the right treatment plans as quickly as possible. That required us to be able to get new lab equipment. And currently today at all of our campuses, we have the ability to get test results very rapidly so we can execute those protocols. And then we moved on to vaccines, right? So since right before Christmas, all of our efforts, once the vaccines came out, we understood, what the vaccines meant, how they worked, how to, administer them. We started our vaccine efforts to be able to implement that next level of science that became public to us.
You talked a little bit about the evolving treatments, not just from how we diagnosed and what we needed, but then how we treated. We watched that as well. Like I say, this was science that played out very publicly in this day and age, but we've gone from convalescent plasma to remdesivir, controversy over hydrochloroquine, and then we've got the monoclonals. And Dr. Longley, Advent Health North Pinellas has really run a very successful monoclonal infusion clinic. Are you still seeing success with that in this current state of the virus?
We are, Rochelle, and that's one of the great things. And just to touch on what Dr. McGinnis mentioned, that standardization has really allowed us to move towards much better outcomes and results. But one of the greatest things that we're doing now, and so many people don't really know about it, even in our community, is the monoclonal antibody treatment. And this is a treatment that is infused over about an hour. And we have infusion centers set, one in Pinellas and then another in Hillsborough County. But and we're also doing it actually through home health care. But these monoclonal antibodies, which are synthesized to go right after the certain proteins in this virus, are actually really successful in dampening down and really reducing the effects of the virus. And we're able to, if we can get a patient treated with this monoclonal antibody, and we're using a combination of two different ones, bamlanivimab and etesevimab, we're actually in about 24 to 30 hours, these folks are feeling significantly better, but we've got to get to them quickly. So within the first 10 days after symptoms start, and we're avoiding hospitalizations. And when we're looking at times when we're really trying to manage the capacity of the hospital and manage the capacity and flow in the ER, this therapy is very useful to actually keep patients from getting really sick and from needing to be hospitalized.
Dr. Doug, I know you have a university background, and so from that perspective of your experience, what is this like to sort of live in the moment of real-time science?
Well, I don't think I don't think anything is compared to this, really, quite honestly, because uh, we haven't really been exposed to a pandemic. Of course, science usually moves a lot slower. To Robin's point, to Dr. McGinnis's point, that in the past, for example, vaccines, et cetera, or therapies would take plans around therapies would take years and years to develop. We had to really accelerate it and really go through processes a lot faster, um, trying to make and not trying, but actually keeping everybody safe. So this is, I think, uncharted territory, whether you're in academics or not in academics. But I think this also has shown that our health systems are able to turn on a dime when we thought they had to turn in years. We've now been turning in months. So it's been pretty uh, impressive, both the clinical care and the evolution of the different treatments that have occurred, and the sharing of data and outcomes across the United States, across our own company, as well as the development of immunizations. And to Dr. Longley's point, the monoclonals have been really important, a way to treat early to moderate early symptoms, patients who have early symptoms or moderate symptoms of COVID, and keeping them from getting more severe disease. So a lot of change, a lot of change.
And you mentioned something, Dr. McGinnis, we were talking earlier on, and Dr. Longley mentioned it too, not wanting to overwhelm healthcare systems. And I know other healthcare systems were experiencing much more severe capacity and supply issues. Advent Health was really fortunate not to have those kinds of issues. But Dr. McGinnis, I think that also says a lot about your leadership, a lot about the company. And we were a resource in this community for others who needed help, whether it was taking in nursing home patients or working with cities and counties. Can you talk a little bit about what that experience was like, to be the leader, to be on the forefront, and really the advantage we had of not really experiencing some of the horrible stories we were seeing coming out of other places?
Well, absolutely. And I think first off, when I looked at what was happening in other areas of the country, and I'll, use New York City as an example, seeing what they witnessed, probably the month before we began our surge in Florida, quite honestly, I just said from the beginning, that will not be us. Absolutely, positively not. And our supply chain at our corporation at Advent Health, system, they worked diligently to resource supplies nation and globally wide. So we had access to equipment, we had access to staffing. We educated and trained our nurses on the front line so they were equipped to manage the acuity level of the patients that we were going to receive. And then, as our nursing home patients, we protected them by testing them, which then required them to be taken out of the nursing home and come to the hospital, so then we could take care of them. So we did not have the results that other areas of the nation had, as far as, high demise with our nursing home population. We were the recipients of keeping those nursing home patients safe. So we protected them, we kept them well, and then we were able to return them back to their SNFs. And it was really just working collaboratively with multiple entities across our counties, across our states, to be able to support us provide that best care.
Michelle is not. Are you muted, Rochelle?
Oh, thank you, Dr. Doug. This time it was me.
Wow, sorry.
Good catch. No, what I was saying was that Dr. McGinnis had talked a lot about how advantageous we were. So we also have been able to vaccinate to date as a system nationwide over 250,000 people with the COVID-19 vaccine. And we hear about the impact this is going to make on the virus. Dr. McGinnis, I was wondering if you could talk about that part of where we're at now. Everybody keeps saying the virus gives us hope, and we are seeing some changes coming. But what does it mean to the real containment of COVID-19?
So first off, vaccines work. Vaccines have always worked to mitigate disease, right? So, when we get immune from a disease, it happens either you have a natural immunity because you've contracted the disease, or you get vaccinated to avoid the disease. The more and more people in the community that have one of those things occur with their immunity, that prevents the disease from getting from person to person. So the more percentage of people that contract that immunity in those two ways, the rest of the population is protected. And that's good news because that helps people not get sick. And most particularly are the most vulnerable people in the communities that already have weakened immune systems. It protects them as well because they may not be able to get a vaccine. So we're seeing that progress is being made by what Dr. Doug had talked about earlier, by us seeing less patients being admitted to the hospital. Patients are a little bit less sick than they were a year ago. Number one, because we have the capabilities of identifying them quickly and implementing treatment protocols quickly to help people get well faster. But in general, we are on the right path. We just have to keep up the efforts and not lose faith and use every network that every one of us has around us to support people getting vaccinated because it works.
What do you think is the best advice? I just saw Pfizer saying, well, first, I think they've said a couple of things, maybe a third shot, and then most recently this week, maybe longer time between the booster shot. So if you're somebody out there right now and you're on the fence and you can't decide, and maybe some of these things are hanging you up, what's the advice from anyone in this group for people trying to make that decision and seeing this information come out?
I don't know if I'll take, I guess, the first shot at this. Honestly, we're seeing the results of very positive results from immunization. Yes, we may need a booster some point down the line. Yes, there are variants, and the different variants are more or less responsive with the vaccine. But everyone possible to what Dr. McGinnis was speaking about, getting to the point of herd immunity, is critical. And so I wouldn't delay whether we're fine-tuning when shots should be given, because they're being given and it's effective, and that's why we're seeing a reduction in the cases. I do also want to add something about the cases. Although we're seeing the reduction and although we're getting better at treating the disease, we still have people who are very sick and people who are dying from this. So I would recommend not waiting around to see about how the tweaks will occur because the fine tuning. I strongly recommend people getting vaccinated as soon as possible. And touching base just quickly to the population that's going to suffer. Patients who have cancer, for example, getting chemotherapy reduces your immune system. You can't get the immunization. Those people are then going to be susceptible to maybe a younger person spreading it to them or whatever. And we have people who can't get the vaccine, 12 and under, for example, they just can't get the vaccine. Those people can act as to spread the disease as well. I'm sorry if I'm long-winded there, Mike.
No, I appreciate the answer. We have someone in the comments asking a question too about variants that we might be seeing. We know we've seen it reported by the state health department. There is a confirmation, there has been for a while, but what are we seeing in our facilities?
So we know that there are variants out there. There's three main ones right now, the Great Britain variant, the South African variant, and the Brazilian that are the most talked about. Great Britain by far being the most prevalent. But fortunately, right now, we're not seeing mutations on top of mutations. So we're not seeing double mutations, which really is good news. And so the vaccines are effective. Their data is very, supportive of vaccines being protective against these variants. And the other thing I did want to add to what Dr. Doug was talking about with vaccines is that these vaccines are safe. This messenger RNA technology is not a new technology. It's new to the public in terms of utilizing it for large-scale vaccinations. But this technology has been around and used for decades in treating many autoimmune issues as well as oncologic issues. So the concern over safety is one that we just, on a daily basis, we talk to community members, we talk to our colleagues and nursing colleagues, and it's important to know. And it also, I've gotten a lot of questions about, well, I've had COVID, do I really need the vaccine? And the issue with having COVID is that natural infection is very variable. And so some folks have mild disease, some people get really sick, and unfortunately many die. Well, there are many factors that go into that, but the vaccine allows us to give a little bit more of a standard immune status to people. And that's where a lot of the success is. And if we can get, a lot more of the population vaccinated for all the reasons that have been mentioned before me, that's really the goal.
This is probably just opinion-based, shot in the dark, but what do we think COVID is going to be to us in the future? Is this going to be like the flu, where every year it has a season, it comes and goes, there's an up and a down? Or is this going to be something like the measles, where we can get a vaccine and maybe it's eradicated and we don't see it in the future? What do you guys think?
Well, I would say that, because it's a coronavirus, it is likely that it's going to act like influenza, meaning that, every year we get a flu shot. The flu shot vaccine is, compiled from the information that, was from the prior flu season. So we expect that there's going to be, some variation to COVID, that we're going to require, kind of additional vaccinations. And likely in a perfect world, it would be annually. We'll get really good at it, and it will be an annual shot. And really, we've managed flu for a really long time. And what's super interesting about this past year, because of all of the mitigation factors that society in general embraced, social distancing, hand hygiene, staying home when you're sick, wearing masks, we saw very, very little flu. So I hope that we've learned a lot just about how to keep each other safe and stop spreading general germs, that's going to work to our advantage, regardless of what we are faced with, whether it's COVID or influenza.
What do you think, Dr. Doug and Longley? I need a calendar to this thing. I don't know about anybody else out there, but the flu is October to May. I get the shot in October. I'm going to need a calendar date here.
Mike might be better at being able to do that, but what we haven't seen is a seasonality around COVID, which is an interesting phenomenon, right? The surges occur really more because of, I think, social engagement and frustration over the restrictions rather than wintertime, summertime, etc. And so I think to Robin's point, I think we need to we'll be needing to get an at least annual booster shot to deal with the variants that occurred, or your immune system against this COVID virus or its mutations, and COVID is going to be in humans really for a very long time.
And I did consult my crystal ball, and it did confirm that what Doctors Ross and McGinnis said is correct. Yes.
I use an 8-ball. I use the 8-ball and check it.
I think some of us feel like that's what the last year has been. It's every week we find something new. But bless all the scientists out there who are looking at this and putting that information out as fast as they have been. Where would we be without that happening? We would not be this far progressed. I'm no scientist, but that's, I feel that would be the case. We have a question in the comments regarding new CDC guidelines. Of course, we heard the CDC talk about fully vaccinated people not having to mask in certain situations, but in others it's still required. And we do have people asking about masks and our hospitals and medical facilities. Dr. McGinnis, can you tell us where we're at with policy on that?
As it stands right now, we're going to continue to require people to wear masks in our hospitals. So that'll be, visitors and any of our healthcare workers. And that will be the same for our doctor's office as well. And really, part of the challenge that we're faced with is, we don't have an ability to identify somebody, whether they were vaccinated or not. So we have to just keep the general population safe and treat everybody in the same way, and we're going to ask them to continue to wear masks.
And before we go, I just want to ask each of you, starting with you, Dr. Doug, what's our next step? What's our next step as healthcare providers? Are we sort of on a maintenance plan? What's our next step as citizens and communities? Where are we at right now with where we need to take this next step in COVID?
I was going to go a little bit more global or universal. Is that what we have learned is that we have to be prepared for pandemics, and I think that we have learned a lot of hard lessons in this COVID, and I'm hopeful that we are taking these lessons and going to be prepared for anything that comes along in the future. I know that Advent Health is preparing for future pandemics, and we will be prepared. And so that would be my number one thing. In terms of where we're going with COVID, I hope that we continue to have focus on it, because I think although our treatments are better, we still have patients who are dying and who get COVID and are dying. So the research, the different development of different medications and treatment plans needs to continue as we have been able to reduce the patients, the number of patients who are getting this disease severely. We need to just continue to focus on that because we still will have patients who get COVID. And I just point out that, yes, when you talk about with the Pfizer shot, 95% efficacy, it means 95% of the time if you get COVID, you have a less than 5% chance of getting severe COVID, but it's still a possibility. And so I don't want to give up on treatment plans and development of better treatment.
Dr. Longley, what would you say? What's next for us, for the community?
I think something that I don't really hear probably enough about is really the individual's obligation as a member of our society and our world to do what you can to, number one, not get sick. As simple as that sounds, it's don't get it. But really remembering to be understanding and respectful of our other people's beliefs and thoughts. We have a lot of great data. We don't have enough data. We don't have all the answers. You can find a study to support almost anything you want to believe, and I think there's a real onus on the medical community but yet on folks that aren't in the medical community to look for good science and demand good science, and to use common sense as well, but to understand that everybody has an opinion, everybody has real fears, everybody has a somewhat knowledge of what they've been reading or hearing, and that vaccines are helpful and safe. And just because somebody may disagree with you today doesn't mean they will disagree with you forever. And just because they're not getting a vaccine right now doesn't mean they're going to say no forever. And we just have to be willing to listen and continue to explain and really sift through the data that we do have.
Very important. Dr. McGinnis, before we wrap, what would you say next step?
And I would just say stay connected to real good, reliable information, and recognize that, as you've mentioned, more than once today, that this is evolving, and we are in a scientific place that things keep changing. So I'd love for people just to keep in mind that when things pivot, if we were told something 6 months ago and now we've been, we needed to shift and do something a little bit different today, that does not mean that we were wrong since 6 months ago. That means that we've learned more. And we're going to continue to learn more and more as we continue to journey through this pandemic. So stay close to trusted sources would be my best advice.
I love what you just said. If something's changed, it's not that we were wrong. It's just that we've learned more. I love that. I'm going to keep that tucked away in my pocket for the future. I just want to thank you all again. I know you're very busy. I appreciate the time that you've taken to be part of this panel. I want to check in again with you maybe later this year. And I want to say thank you again to Advanced Telecom Systems for sponsoring this and allowing us to host this, to bring some education and a little bit of insight to our community. Thank you all. I hope you have a wonderful day, both to our panelists and our participants.
Thanks, Rochelle.
Thank you.
Thank you.